Hello, my name is Bobby Crumhans. I'm a physical therapist. Today I'm going to be doing some joint mobilizations with you, Irina, at the hip, knee, and foot and ankle to help increase range of motion at the hip and knee and for pain modulation at the ankle. So I'm going to start out at the joint line for a hip inferior lateral glide. I've gotten patient consent already, so grade 3 to increase range of motion, large amplitude into resistance. And then grade 4, smaller amplitude into resistance to help increase range of motion at the hip and the joint capsule. And we'll move from that into an inferior glide, caudal direction. Again, my hands are into that joint line. Do a grade 3. I'm not maintaining contact with my hands and my body and moving them together as one unit. And we'll move into a grade 4, smaller amplitude into resistance. Okay, we're going to move into a mobilization to help with medial rotation at the hip. We'll go into a grade 3. This also places the hip in relative hip extension and hip abduction, which are also some limiting motions for Irina. So this is a large amplitude into resistance. And we'll move into a grade 4, smaller amplitude into resistance. Okay, if I can get you to roll to your belly. I'm going to do a posterior anterior mobilization at the hip. I'm going to get close to that joint line. In grade 3, and then grade 4, smaller amplitude at aim range. Again, this mobilization is to help increase range of motion and more specifically into hip extension. You can also add some physiologic hip extension with the mobilization. Irina, you doing okay? Yeah. To further increase the range of motion. Okay, Irina, if I can get you onto your back. We're going to move to the knee. Again, the knee, there's some limitations in range of motion, so we'll be focusing on grades 3 and 4. I'm going to perform anterior-posterior mobilization. Grade 3, large amplitude into the range. This is to help with knee flexion. We're following the concave-convex rule, so the tibia is concave, so providing the mobilization in the same direction. Grade 4, smaller amplitude into the range. I can also add some internal rotation with the mobilization. This just follows the normal orthokinematics of that knee flexion motion. You okay, Irina? Mm-hmm. I'm just going to move the towels down. She's got some limitations with medial glide and inferior glide of the patella. So I'm going to do a combination movement going in inferiorly and medially. So grade 3, large amplitude into resistance. And grade 4, small amplitude and range. Irina, you okay?
Yes.
Because of the size of my hand and the size of her patella, this was the best hand placement for me. Okay, if I can get you to roll onto your belly. We're going to continue with anterior posterior mobilization of the knee to help with knee flexion. I'm going to place the knee at the physiological range, which for her right now is about 100 degrees. Hands at the joint line. So grade 3, large amplitude into resistance. Irina, you okay?
Yeah.
Grade 4, small amplitude at end range, or small amplitude into resistance. I can also add some physiologic knee flexion as I perform the mobilization to further gain some range of motion. You okay, Irina?
Yeah.
And I can add some medial rotation with that mobilization just to follow the normal arthrokinematics of that motion. Okay, and lastly, we'll work at the foot and ankle. Foot and ankle is limited mostly by pain. Pain's at a 6 out of 10. So I'm going to start out with a distraction at the talocrural joint, focusing on grades 1 and 2. So grade 1 is just thinking about it. Grade 2, larger amplitude into the resistance-free range. You doing okay, Irina? I'm going to also move into the subtalar joint, performing the same distractions, grade 1, just thinking about it. Grade 2, larger amplitude, resistance-free range. The distractions are to help decrease or to help further decrease pain. Just distracting those joints, the talocrural and subtalar joint. I'm also going to do a posterior anterior, grades 1 and 2, to help with pain modulation at the talocrural joint. Grade 1 is just thinking about it. Grade 2, larger amplitude, resistance-free range. As we diminish the pain and she's able to move into a grade 3 and 4, this mobilization will help with plantar flexion. And I'm going to do a anterior posterior mobilization at the talocrural. Start with the grade 1, just thinking about it. And moving into a grade 2, larger amplitude, resistance-free range. And again, as we diminish the pain and she's able to move and tolerate a grade 3 and grade 4, the anterior posterior mobilization will help with dorsiflexion. That is it. Thank you very much.